First question is: I've been recently turned on as an avid listener of your podcast. I wanted to reach out and say that I really appreciate all your information you share. I've been interested in learning more about SM recently. I was wondering, what kind of training and qualifications must someone like me have in order to begin treating children with SM?
Great question. We get asked this often. In order for somebody to treat selective mutism, they need to be a licensed professional. This would be a licensed mental health professional, such as marriage and family therapist, social worker, licensed professional counselor, at the minimum a master's degree, or a individual that continues on and gets their doctorate, a PsyD or a PhD, a speech and language pathologist, and a physician, a medical doctor or an osteopathic physician. Those are the individuals that can really do the diagnosis, assessment, and treatment. Because selective mutism is considered an anxiety disorder, it's said that speech and language pathologists don't do the official diagnosis. So the mental health professionals, the physicians do the actual diagnosis, but speech and language pathologists are wonderful, wonderful professionals to do assessments and do treatment. In fact, we have done research-based assessments on children with selective mutism because they don't speak. So using a speech pathologist to assess their speech and language skills is really critical, especially since 30 to 40% of kids with SM can have an underlying speech and language pathologist. I do want to say that there are a lot of other professionals. Teachers can help and assist. It's pretty much endless of who can help and assist. It's whether the treatment aspect is what you're looking for. I do encourage you to go to selectivemutismcenter.org or the Smart Center in the resource section for webinars, articles, handouts, charts, etc. We have a wonderful webinar called What is Selective Mutism? Gives you an overview of what selective mutism is. As my listeners and clients I've worked with, and so many know that I see SM as a social communication anxiety disorder rather than kids that or teens that don't speak is really important. So getting a really good understanding of what this is important. Going to the Selective Mutism Association or selectivemutism.org. That is the organization, the nonprofit organization that I founded many years ago. That's mission is to educate, promote awareness, and there's tons and tons of information on that website. Also, we have a lot of individuals that may not be licensed professionals, but want to come and help and learn more. I encourage that individual to reach out to us at info@selectivemutismcenter.org because there's opportunities to volunteer at Communicamp. It's the 3+ day intensive group treatment and parent training program that we do at least 7 to 8 times per year. It's a wonderful opportunity to be immersed in this population. It's a great way to get your feet wet. And if you are in the educational field or any sort of mental health field, if you're in school and you're interested, there's definitely roles for you in terms of actually working with the kids.
So, if I'm someone who wants to help out at community camp, do I need any qualifications to be a counselor?
Yes, definitely. You need to be at least in a graduate program for mental health or speech and language or occupational therapy in an area of, helping these individuals for that sort of background. We do the training to get you kind of ready, being more of a junior counselor or a helper in that case, not necessarily a counselor, because the counselors at Communicamp are clinical counselors that have more advanced degrees. But there are many that just come and volunteer. They volunteer with the parents, they assist, and
Yeah,
so forth. So you
probably learn a
definitely
lot.
need to have, yes, you definitely need to have clearances to work with the kids as well. And that's something that we can help you with.
Okay. So, in terms of treating SM, if I start right now with zero qualifications or zero experience in SM treatment,
You
how
can look
long would
into
it
a,
take? How long would it
it could
take?
take, it depends on your undergraduate background, frankly. Like if you have no classes in any sort of mental health, psychology, And it really depends on the avenue you want to go. So I don't have that answer. I would say it's a minimum of 2 to 3 years of at
Okay.
least getting a master's degree and background to be able to actually treat.
Right.
But again, there's other roles that someone can do to assist. That doesn't
Mhm.
necessarily mean they're the primary treatment professional.
Okay.
It could be more on an intern level or an associate level to assist a treatment professional in the office or in other settings, in the school and so forth.
Yeah. Gotcha.